I'm Dr. Gerald Chodak. In this video, I want to discuss the CAT scan as a tool for staging your cancer. The CAT scan can be ordered either when your cancer is first diagnosed, which is the most common time it might be suggested, or if the cancer is recurring and we want to know what's happening in the rest of your body. Let's first talk about using the CAT scan at the time your cancer is first diagnosed. Why do we want to do this? Well, number one, we'd like to know if the cancer has grown outside the prostate, into the seminal vesicles, or into the lymph nodes. Unfortunately, the CAT scan is a very inaccurate test for identifying cancer when it's first diagnosed as being spread or having spread into those organs. Why is that? Because today, in 2007, 2008, we do not see many cases in which the cancer has spread into those areas of the body. The CAT scan is just not a very sensitive test for finding small microscopic amounts of cancer, and in most cases it's not present anyway. We have other ways to predict whether you are likely to have cancer in the lymph nodes or not. So doing this test prior to undergoing, say, surgery for prostate cancer just doesn't provide very useful information, except in an extremely rare case. So the CAT scan as a staging tool is not very helpful. If you're going to choose to have radiation therapy, a CAT scan will be ordered because it's necessary to plan where to deliver the radiation. But that's a different reason to undergo the test. If you think you're going to have surgery, or if you're even not sure what you want to do, the CAT scan is not very useful. Now, CAT scans will be done if the cancer recurs, or if the cancer has been treated and found to be more advanced. In those circumstances, CAT scans can be more useful. But they don't seem to be very useful, and they're really not worth the time or the money or the discomfort if you've just been diagnosed with a cancer and your PSA is in the 10 range or 20 range. Under those circumstances, it just doesn't give you much useful information. So save yourself the time and inconvenience. Don't get the test. If your doctor suggests one and you're not necessarily going to have radiation therapy, then have a conversation and ask him, why would you do this test if the information is not very helpful? Getting baseline information, which has often been done in medicine, is just not a smart way to practice. And more doctors realize that and are not just getting tests so we can have more information available. So I hope this information is useful to you. CAT scans are not very good as a staging tool for early stage prostate cancer. Thank you.